So the overview of the session which I gave was really trying to persuade the delegates to understand the importance of epidemiological data in trying to develop a service for multiple sclerosis and related disorders, and the importance of data collection and the value that has in being able to leverage new funding and developments within your service. We then went on to talk about environmental factors and the increasing relevance of this, particularly over the last few years, with a refocusing on issues such as vitamin D, EBV infection, obesity, smoking, and vaccinations. I then went on to give an overview of the available evidence, and in particular the hierarchy of evidence with regards to prospective cohort studies and case control studies, which has provided some guidance on interventions, particularly for vitamin D and relevant dosing. The main take-home point of my presentation was that everybody who is developing or organising an MS service needs to understand the basics of epidemiology of multiple sclerosis, and in particular the burden of disease in the population that they look after and the breadth of the phenotype that presents to them. It's a key point in developing resources for services. The second point was that of all the environmental factors, really it's only vitamin D that lends itself easily to clinical trials and interventions, and some of these are ongoing and we should have the results within the next 2 years. It's important that we don't muddle up risk of disease development and risk of disease progression, and that's particularly an issue with regards to vitamin D.